Dr. Farmer, could you talk a little bit about the different cultures in Liberia as opposed to Sierra Leone and Guinea? And we congratulate you, Madam President, for your tremendous leadership and work in helping to really focus in and isolate this problem in your country. But could you just generally speaking, explain why it is so successful in Liberia and not so much in the other two countries?
Thank you, Senator. And he's setting me up, Madam President, because he knows I also have a PhD in anthropology, but which makes me cautious in answering. You hear, I've heard and read as well about differences in those two countries that are fundamentally cultural, linguistic, historical differences that would determine the pace at which there's been uptake, for example, of safe burials or improved infection control practice. And you've heard those claims made as well. I'm not sure that it's a good idea to put too much faith in those claims yet, because we've failed so far to have in Sierra Leone, to have a real collision between modern medicine, including prevention, and Ebola. And that's true as far as safe burials goes as well. So the focus for us should be on, as Anne said, on listening to people, on talking to religious leaders. And that's been done perhaps more successfully in Liberia than elsewhere, and I wish I knew more about Guinea. But in each of these places, the response needs to do that better, to listen more carefully, to engage with religious leaders and families in their homes, and to have frontline workers be our other bridge, as well as religious communities, to the household. And that is it's not that that's an acultural process, right? But that's something that is working with community health workers. It's, in my experience, worked in Haiti, in Boston, in Rwanda. It's a structural intervention that needs to be shaped to local cultural practice, but can give a very big return, I think, in regardless of which part of this of West Africa we are.
Do you think it would be helpful if there was a larger U.S. presence in the other two countries, given what has now happened in Liberia, that if we ramped up a larger U.S. presence in the other two countries, that it could make a big difference in telescoping the time frame that it would take in order to successfully replicate what has happened in Liberia?
I would just say having a larger expatriate presence is a good thing if those expatriates, regardless of their origin, have the skills that are needed. Mm-hmm. And some of those skills are clinical skills, as was noted. That is, delivery is a big problem, Senator. We have the right ideas, we have the information, but we're not delivering, especially that last mile in rural areas. So, logisticians we still lack. People who can, President Sirleaf has said before that there's more electricity generated to power the Dallas Cowboys Stadium, than the entire country of Liberia. So there are things that we need in that staff, subspace, and systems that I would say bring it on. And I think the United States, as Pop Guy said, we have been, had this mantle of leadership in global health for the last dozen years, in any case, if not 15. And I think we'd be welcome. So are the Cubans welcome, because they're bringing delivery capacity. And so are those who can bring laboratory capacity and logistic capacity. We have a long way to go, it seems to me, especially out in the rural areas.
Yeah, Dr. Peterson.
Thank you. I went from Liberia to Sierra Leone, so I got to see a little bit of the comparison. And when I look at the epidemiology of what happened, the Ebola epidemic made a very fast, fierce round through Liberia, and we saw a lot more cases there early on than we saw in Sierra Leone. Sierra Leone is doing the same round, started in one part of the country and moving from hotspot to hotspot, but it has done it more slowly. I think what we are seeing now is completely predictable because the place it hadn't yet reached was Freetown. It hadn't reached Freetown with its slums that have no running water, that have no sanitation, where people are very close together. It was just arriving there as I left a month ago. And so Sierra Leone has a larger population. In the end, are the epidemics going to be really different? I don't know. We can and should roll up a much stronger response in the urban and peri-urban areas, especially of Sierra Leone. It is possible in each of the countries they could do another round because it has been hotspot to hotspot. I think we are now ready to jump on and stop each one of those new sort of satellites from expanding, and that should be our focus. So back to the communities and identifying every patient.